The Camden County Cancer Screening Project at Cooper is a program that provides screening, outreach, education, early detection, prevention for our underserved communities in Camden County. Hi, I'm Evelyn Rodriguez. I'm an oncology advanced practice nurse and director of outreach, prevention, and survivorship at MD Anderson Cancer Center at Cooper. Our goal is to make sure that our uninsured patients have the same care as their insured counterparts. Screening is extremely important because we know that screening tests have two goals: finding cancers as early as possible, as well as preventing cancers. We focus on breast, cervical, prostate, colorectal, and lung cancer. For prostate cancer screening, we start screening at the age of 40 for African American men, as they have the highest risk in the world of having prostate cancer. We also have lung cancer screening, and the lung cancer screening is for people who are smokers, who have what we call a 20-pack year of smoking history, and we provide skin cancer screenings out for people who are interested, whether they're insured or uninsured, and we provide oral cancer screenings for anyone in the community who's interested, whether insured or uninsured. If we have someone with an abnormal screening finding, we have a nurse case manager who contacts them and sets them up for any follow-up that's necessary. We have funds through ScreenNJ. We have funds through the NJCEED program that provides those diagnostic testing for free. And we bring the patient all the way up through treatment. So if a cancer is found, we then hand that patient over to our navigators in the cancer center, who then take over for the care for their treatment of their cancer. If someone is insured but does not know how to navigate the healthcare system, we bring them in as well. We work with their insurance, and we make sure that that navigation piece, which is sometimes the hardest piece for people in the community to access the healthcare system, that's done for them. If they need transportation in order to come in for their appointment, we provide the transportation for free. If they need translation services, we provide translation services for them. So our goal is to ensure that these people in the community who are having a hard time getting into the healthcare system, that we remove as many barriers as possible and make sure that they have wonderful quality care as they go through their journey of screening. The cancer screening program here at MD Anderson Cancer Center at Cooper has navigators who really are mimicking the community that we serve. They are bilingual, so we have a navigator that supports our Spanish-speaking community. We have one for our Indian community. We have one for our Vietnamese community. And all of these navigators work closely with our community members and our community partners to make sure that they deal with the cultures and with the concerns that our cultures are worried about that prevent them from coming in for screening. Fear is one of the biggest barriers to screening in our community. Fear of maybe the finding, what's going to be found with that screening, what's going to happen next. Sometimes fear of pain, that the test that's going to be done is embarrassing or is painful and they don't want to move forward with getting that step. What I say to our community is grab the hand of someone you love, whether it's your mom, whether it's your sister, whether it's someone you love dearly who's a good friend, and go with them. Allay some of the fears that prevent them from coming in for screening and be that guiding hand, because you doing that can really save a life.